Hey, everybody. Welcome back. Thank you for joining us on today's episode. This one is for the ladies. I say that sometimes, but if you're a man, still for you too, because if you have a lady in your life, you for sure want to listen to this. I know this will serve you as well, but we have an expert on hormones with us today. And this doctor has so much experience in female hormones specific to transitioning perimenopause, menopause, and chronic disease, brain diseases, cognitive disorders. So she can speak to hormones beyond just the conversation you're probably hearing on social media or any platform where they're just talking about any one symptom that is connected to a hormone imbalance. So we're going to talk about really how hormones and transitions of hormones can play into more severe chronic disease patterns and how you can avoid them, how you can help support them. So our guest today is Dr. Kavita Desai. She is a hospital-based pharmacist, but she founded the company called Revivel and has so many resources, a book, a supplement line. She's got so much for women when it comes to their hormone health. So we're going to talk a little bit about her book, which is called Lady Parts, Putting Women's Health Back into Women's Hands. But I think we've got a lot to cover here. So Dr. Kavita, thank you so much for joining us today. I'm thrilled to have this conversation and personally have a lot of interest in learning more about this. So I'm happy to have you.
Great. Thank you so much for having me. It's my pleasure.
So let's just let you take the floor right away because there's so much that our female audience can gain from this. This is a question I get on Instagram a lot of times from women that are entering into perimenopause or transitioning out of perimenopause. And they're curious as to, what should this transition look like? How do women transition hormonally in a healthy way? And if you don't transition, what are the downsides? What are the risk factors for developing disease later on? So maybe just walk us through how you got into this, why this became a priority for you to really learn. And then we'll just kind of go from there.
Yeah. So the reason I even, founded Revivel, got into this particular space in medicine, started back in my clinical practice. I ran a cardiovascular disease prevention clinic for a few years that I founded. And so that's where my interest in preventing disease came from, that I think, once we're sick, it's too late usually. And then soon thereafter, I opened a interdisciplinary medical clinic where we were seeing a lot of patients with chronic pain, and a large portion of that population was women who happened to be probably in their perimenopausal years, who also happened to be diagnosed with fibromyalgia, which is a chronic, widespread pain syndrome that tends to affect women more than men. And we see in that population, not only does it affect women more, but they tend to be perimenopausal, and there usually is some sort of hormonal imbalance as well. A lot of these women can genuinely probably benefit from hormone replacement or having their hormones assessed. It's usually not done. I mean, these syndromes are usually not even diagnosed. They're usually dismissed. I feel that most things that women tend to experience more than men tends to get kind of swept under the rug. Maybe we don't complain enough, or maybe they're just, the symptoms are too general, right? It all sounds the same. Perimenopause to fibromyalgia to numerous other inflammatory conditions. They all sound very similar. It's hard to tease them apart. So in our practice, we actually saw thousands of women with fibro. We were able to help a lot of them. And it was in around that same time that my mom, who also would have been perimenopausal at the time, ended up being diagnosed with early onset Alzheimer's. So she, sadly, her symptoms started at a time where she would have been in her early 50s, still hadn't reached menopause yet, had the stereotypical, I think, symptoms that women have. She would feel hot, in certain scenarios. She wasn't sleeping as well. She had some gut dysbiosis. Other than that, did not really complain about anything, certainly did not mention anything about memory. And I didn't notice anything to do with her memory. It was more personality changes, which again, we see during perimenopause, right? We see a lot of increase in anxiety and other mood disorders, irritability. So it was just kind of, I think, brushed aside as being normal for aging. And in the end, she actually ended up having early onset Alzheimer's, was diagnosed prior to the age of 65. And so that is what compelled me to found Revivel, because I think there's too many chronic diseases that affect women that we're not addressing, a lot of them have a hormonal root to them. And a lot of them, we're at an increased risk once we hit perimenopause. The loss of those hormones definitely impacts a lot of our body systems. And this can now lead to chronic disease. And I think we don't really treat perimenopause as a syndrome, right? We treat it as just a stage of life, which it is. And I think, again, I'm not trying to fearmonger, but I think it does put us at an increased risk during this time. A lot of these symptoms are risk factors for chronic disease. They're not just symptoms. So it's not something that necessarily we should be just living through.
Wow. I don't think that I ever really thought about it that way too, but how you go through the transitions can oftentimes, that is the setup. And so it can oftentimes be the guiding North Star. Like it can put you in a trajectory where you are more at risk for some of these disease patterns. And I think a lot of women, I know for me personally, if I'm in a health season where I just feel like, okay, this is just a part of, the transition of aging, like I'm like, I just want to get through it. I just don't really think about, okay, how do I support my body? I just want to get on the other side. I just want relief. So for the women that are in that season, maybe start us off by pointing out the areas that they should be clued into, or they should be prioritizing, like what areas of their health, whether it's stress or sleep, what is it that is the most important when it comes to perimenopause that they need to be prioritizing right now to prevent some of those things down the road?
Yeah. So I think one way that I like to paint the picture is, when we have a loss of insulin, we replace our insulin. If we, have thyroid disorders and we have low thyroid levels, we replace it. So the only true way to really improve these symptoms is with hormone replacement therapy, which we know we've debunked a lot of the old rhetoric that it increases cancer risk and it increases risk of blood clots. The contraindications are actually not as broad as we once thought. Family history is not a reason not to use it. It's much, much safer. The newer formulations are much, much safer. So that's usually what I recommend. I actually was asked very recently by a friend that if you don't have severe symptoms, would I personally still consider hormone replacement? 100%, because we still need these hormones, right? Like you have to think this is an entire hormonal system that shuts down for women, and we need estrogen. It's in our brain. It's throughout our body. It helps us function in so many ways that would be my number one recommendation, obviously. But beyond that, there's a lot of lifestyle changes that we can make. For Alzheimer's, for instance, prevention is lifestyle based because there isn't a cure that we know of. So it really is prevention. So some of the main risk factors that we go through during perimenopause that also impact our long-term health are things like, yes, sleep, like you mentioned. Disrupted sleep becomes an issue as we lose estrogen and progesterone, and then also now impacts the brain and the gut, and can lead to numerous chronic disorders, fatigue, depression, anxiety. The other thing would be stress reduction. I think as women, we already tend to carry a lot of burden. We already tend to worry maybe more than our counterparts. But during perimenopause, again, our cortisol levels tend to go up, which means we are sitting in more of an anxious kind of panic state than maybe in our younger years. The other thing that tends to happen with the loss of estrogen is we get a gut dysbiosis. So again, we want to be addressing gut health, and that's primarily with diet, right? And obviously you can take a good quality probiotic as well, but adding in probiotic foods is very beneficial, eliminating sugars, alcohol, processed foods, all of the standard dietary changes. Exposure to toxins, and that becomes another big thing where we tend to become inflamed during our perimenopausal years. Again, the loss of estrogen can result in a lot of inflammation, especially joint and muscle pain. So now maybe being a little bit more conscious of what we're exposing ourselves to externally as well as internally. So it comes from diet, and limiting maybe the chemicals that you're exposing yourself to can make a big difference on that inflammation. And then things like vitamin D levels, which don't necessarily are not necessarily a causation of perimenopause, but I would say in our practice, 90 to 95% of the people that we tested for vitamin D levels had low levels. And for disease prevention, we know that the vitamin D level that we're aiming for is actually slightly higher. So, making sure you're getting your exposure to sunlight and supplementing usually is generally necessary. Then we're looking at things like your blood sugar. So glucose intolerance becomes an issue during perimenopause, which we know Alzheimer's is often called type 3 diabetes. So we know that this imbalance in blood sugars is not only an issue from developing diabetes, but also for brain health.
Yeah, that's so great. I definitely have heard a number of our guests talk about fasting and some of its benefits in supporting that insulin cycle and insulin resistance when it comes to those transitions for women. But I want to focus in on the hormone replacement because I think this is really interesting. And I don't know that we've talked about this recently. Maybe distinguish between HRT, just traditional, hormone replacement therapy, and bioidentical hormones, and which hormones specifically you're talking about. Is it estrogen, progesterone, and testosterone? Are there different compounds that if you're recommending it for most women, are they getting all of these hormones, or are you testing hormones to find out what they truly need? I think that this is something that I've used bioidentical hormone replacement therapy in the past when I've had a lot of hormone issues, but I think in the natural health space, there could be some confusion around it because we're afraid that maybe we're using something that may be disrupting the normal biology of our body. So maybe just talk about those forms of hormone replacement therapies.
Yeah, so it depends on your age, right? Perimenopause can start anytime after the age of 35. So I think if you're starting to experience symptoms anytime in your late 30s onwards, it likely is perimenopause, even if it doesn't stereotypically fit the mold of who we think is perimenopausal. After the age of 40, blood work is not necessary. We know that our estrogen and progesterone are dropping, the levels are diminishing. So in the medical field, you really don't actually even need blood work. You can get a baseline, but again, our hormones fluctuate so much that it's not always indicative of exactly what our hormones are doing, but it can give you an idea, right? If they're low or not. But usually after the age of 40, and when we know you are likely perimenopausal, it's actually dose adjusted based on symptom relief. So you'd start with a low dose of estradiol, and progesterone is a standardized dose. And then you just adjust the estradiol based on symptom relief. But when we talk about bioidentical, it's just a term that we're using to say that estrogen is as closely, and the progesterone are closely mimicking our natural estrogen and progesterone.
Okay.
The old formulations, the ones that those old studies were based off of, were oral progesterone and estrogen, and they were synthetic forms. The newer formulations are estradiol, and we like to use that topically. So we don't want to take it orally because that is where the side effects tend to increase. But topical estrogen or estradiol has been proven to be very safe. So it usually comes in a gel, a patch, a cream. And we all absorb things differently. So again, it may take a little bit of trial and error in terms of determining which formulation works best for every woman. And then progesterone, we want to be taking an oral micronized progesterone. And that comes in a little gel cap. It's taken, if you have a uterus, you take progesterone. If you don't, you don't have to. You can for some symptom relief, but you don't have to if you don't have a uterus. And it's usually dosed cyclically. So unless if you're still having a cycle, we just take it for part of the cycle, anywhere from 10 to 14 days of the cycle, of the tail end of our cycle. And if you do no longer have a period, then you can take a lower dose every day. And so it's very simple. Testosterone is a little bit trickier because they aren't making FDA approved medications for women. So currently what's available is higher dose. It's a little bit harder than to dose it for a woman because you have to use like small amounts of the gel that are generally meant for men. And physiologically, our levels of testosterone need to be a lot lower, right, than what men use.
Yep.
So there's certainly a lot of benefit to it. It can help with muscle mass and then therefore bone health, with libido, but it's not always first line. Usually we wait until a woman is complaining that she has literally no sex drive before it's started. But it's always something worth talking about with your healthcare practitioner because I think there's a lot of benefit to having a little bit of replacement if you're not feeling well. It can make a big difference for a lot of women.
Okay. And I mean, are most women just on that? Like, do they have to change their dosage as they get older or transition into menopause? Like, how often does that change kind of like the dosing and the scheduling of using that as you kind of progress, as you go through these seasons of life?
Yeah, so it will change, right? Because I think if you were in your late 30s, early 40s when you started, and you can be in menopause for a decade or longer even, obviously your levels will start to fluctuate, will go down. And I think this is where it becomes really imperative. And I think even earlier, at an earlier age, even before we hit perimenopause, this is why when I wrote my book, it was more about, I really wanted women to be aware of their own bodies, because no one knows your body as well as you do. And what's normal for one woman is not normal for another. Our levels can vary differently. What my estrogen level was in my 20s might be very different from somebody else in their 20s. So when we don't know those facts, right? Like now that I'm in my perimenopausal years, I don't know what my estrogen levels were when I was young and they were at their prime. So it's a lot of trial and error by the time we reach our perimenopausal years. And it really does go based on your symptom relief. So the dose is increased until you feel your best. And yes, that may need to be modified as you progress through perimenopause.
Okay. What is the connection to the adrenals? Because I know that as the ovaries, they start to transition out of being in charge. They're the ones, the star of the show for women in their fertile years, their cycling years. What is the connection between adrenal dysfunction or kind of adrenal fatigue is like, I don't know, it's that people hate that term, but for lack of better words, like, are there ramifications for having such a high stress burden, having the adrenals be really taxed, and then entering into perimenopause? Do you see women that struggle more, that maybe have had cortisol issues, running really hard in their 30s, then they get to perimenopause and all of a sudden it's like their body is just throwing them for a loop? Can you explain what is happening there with the adrenal glands and why maybe high stress patterns can create more symptoms or undesirable symptoms in perimenopause?
Yeah, so that's all linked to estrogen, right? As we lose estrogen, we produce more cortisol. Yeah. So 100%, even if you didn't have any stress issues prior to your perimenopausal years, you quite likely will notice that you're feeling more stressed. It can even be little things like your reaction to normal scenarios changes, right? Where scenarios that in the past you had no problem, it didn't stress you out at all, suddenly can become quite bothersome. I know women who can't sit in the middle seat in a movie theater anymore. And it's little things like that you wouldn't have even thought of before, that suddenly can start to become quite bothersome. So I think, yes, reducing stress levels, addressing your cortisol levels can become very important as we age. It impacts the brain. It impacts a lot of our well-being, our sleep. That I think it's one of the things that we probably take the least seriously. I think we are a society where we live in this kind of stress, whirlpool, and we power through, and we don't always prioritize our mental health, right? We will address like very blatant physical symptoms, I think, but not necessarily when it's more of our mental health issue. So I think, yeah, and it's something that even for myself, like meditating, I'm not good at it. I'm not good at just stopping and taking that time, even 20 minutes a day to do a proper meditation to kind of calm my own mind. And I think that's something that a lot more women probably should be doing, because it's hard, right? It's hard trying to balance all the things that you probably already have on your plate and then be feeling kind of crappy and not feeling your best. And suddenly you're mourning who you once were and how you felt. And it can be like a switch where you're feeling fine up until you're 40, 41, 42. And then suddenly these symptoms can hit like a brick wall. And I think that can be very disheartening and can add to our stress levels.
Yeah. I mean, the stress thing it's really everything, right? Because we start to burn ourselves out and we reduce our capacity to be able to function at a healthy level. And then that hormones, they're the first on the chopping block. So if the hormones get disrupted, not only do you not feel well, but it's like just part one of a cascade of other things that you begin to experience. So talking about brain health, because this is really important to a lot of women, especially because we are seeing cognitive decline at an earlier age, like you described with your mom. What is the connection between hormones? What is that mechanism between hormones and cognitive decline, or the just the brain as its own system? Like, why is it that we're seeing deterioration in our brain health and in the nervous systems specifically?
So it's twofold, because we know we have numerous estrogen receptors in the brain itself. So now when your estrogen levels are low, it's already directly impacting brain health. So the loss of that estrogen already impacts your cognitive function, which is why a lot of women during perimenopause start to feel a lot of brain fog. They start to feel like their memory's going a little bit, that they're having difficulty with word recall. And the worrisome part is that actually just perimenopause, or is it a sign that, you know, you may be struggling with cognitive decline and have an issue ahead? So that's just one component of it. Then you look at all the symptoms that we experience during perimenopause and the cascade of effects that this loss of estrogen and progesterone have in our body, that creates all the other risk factors that we know are risk factors for Alzheimer's. So that's the gut dysbiosis. Again, there's a gut-brain link. So you start impacting gut health, you're automatically impacting your brain health. The disrupted sleep, there is studies done showing that, you know, poor sleep can lead to a lot of brain and cognitive issues. We talk about, you know, increased stress levels. We know that there's an impact of stress on the brain. Then vitamin D is just a whole other thing. Now, if your gut's not functioning, you're not absorbing vitamin D, you're not absorbing your other nutrients. And again, it's impacting the brain. So the perimenopausal years are impacting our brain from so many different angles. And those are the same things that a cognitive health specialist would be asking his or her patients to address, aside from perimenopause. And we're now all of a sudden experiencing these things all at once because of perimenopause. So it's concerning. And my mom, interestingly, had all of those things. Like at the time, I was still fairly young when she became ill, and, I didn't know the correlation. But now when I look back at her medical history and what I know about perimenopause and the impact on the brain, she had all those things. I remember her complaining that her digestion was not the same, that she was having struggle, like she was struggling eating the same foods as before. She was struggling with sleep. She was glucose intolerant. I remember she had started metformin at the time. She had a wrist fracture. She slipped on some black ice and broke her wrist, which meant she was probably osteopenic, probably had low vitamin D levels. She had elevated cholesterol, and it all hit her in her 40s. I remember all of these things. And at the time, I never thought of her as ill. The story I used to tell about my mom developing early onset Alzheimer's was she was an otherwise healthy person and she got this disease. But now when I'm listing these things, that's not healthy at all. And it was all stuff that came during her perimenopausal years. She was actually quite healthy prior to that. So, which of these is the switch? We don't know for, impacting our risk of Alzheimer's, but I think that's what makes it even more imperative that we're addressing all of our risk factors and all of our symptoms, because I think we don't know which one could lead to something more serious.
Yeah. Yeah. So outside of evaluating kind of what the patterns are that people are seeing, and I think that is step one, is where are we at? Beyond that, what is it that you feel like you would be recommending? So if you were to go back to your mom in those earlier, stages, and knowing what you know now, what would you have changed then that, would have maybe changed the outcome that you experienced before you kind of stepped in and were able to say okay, now we need to reevaluate? Because that's where a lot of women are at, where we just want, it's we're willing to do the work, but I think that a lot of times we don't know with confidence what we really should be prioritizing. And a lot of times, I think most of us make a mountain out of a molehill because everything is alarming. Everything sounds the alarm bells. And it's oh my gosh, I have a headache. I probably have a brain tumor. That's really I know I for sure have been on that path. I'm just like, oh, I don't, you know what? I feel like I got dizzy. Like I'm probably have like 3 months. Like, and I'm just, it's my blood sugar. It's not, anything super serious, but for somebody that's informed enough where they're paying attention to their body, like how would you help that person? What would you be advising for them that they can do in their own home to pay attention to things? And what would you be making as a recommendation? Now, obviously it's very individual, but outside of like hormone replacement therapy, are there specific foods? Are there herbs? Are there certain systems within the body, the brain, the liver, things like that can be prioritized in terms of how you live your life, the foods, the supplements that you're eating? Walk us through that, because those are the real tangible steps I think that can support people as they're navigating through these seasons of their life.
Yeah, I think, my answer unfortunately is not simple. Like, I think my opinion on this, because I'm not just looking at symptom reduction, it's more disease prevention. It has to be comprehensive. So I like to use the analogy that, our risk factors for chronic disease, which happen to also be the symptoms we experience during perimenopause, are like tiny leaks in the hull of our boat. So if we're a ship, we have all these little risk factors and symptoms that we're experiencing. If we only plug one or two of them, or only address one or two of them, your boat may stay afloat a little bit longer, but quite likely is still going to slowly sink. And I think for disease prevention, we really only have one chance. And, yes, I guess we're not afraid of certain things because I think we figure we can treat it after the fact. But when I watching my mom go through Alzheimer's, I think is very eye-opening that she did not have a family history of this. We don't know why she in particular got this and then passed away. And it is a death sentence. So for me personally, in my own life, I think you only have one chance, right? To live your healthiest, to live your best. And we only have one body. So it's in our best interest to, I think, protect that one chance we have at staying healthy and feeling well, because there's nothing worse than aging and not feeling well. So I think it means, yes, addressing diet. And I think, whichever diet that is for you, that is as healthy as possible, right? So I'm a big advocate of a whole foods, the mind diet in particular, which is lean, healthy proteins, a lot of plant-based, skew to it, a lot of anti-inflammatory foods. So focusing on the berries and, a lot of the leafy greens along with proteins, and reducing, all of the things that we know impact the body negatively. So the sugar, the processed foods, the alcohol, all of that stuff. Then you have to look at your stress level. So I think that's finding activities, whether it's meditation, yoga, journaling, walking in nature, whichever it is that calms your nervous system down, I think is imperative. I think we need to address sleep very, very strongly, because I think we all have very poor sleep hygiene, and it becomes harder and harder as we age to get a good night's truly deep sleep, between 7 to 8 hours of really, truly restful sleep. So I think that means changing how much we're on, devices, and making sure the room environment is cool, dark, comfortable, and I think that's something that we really shouldn't be taking for granted, because that is when our brain gets cleaned up, right? Our brain heals itself at night, as does the rest of our body. So I think, that 7 to 8 hours is imperative. And then I think this was the whole reason I created my essential supplement line, because, whether you're a supplement person or you're not, I think from my perspective was I couldn't eat and exercise to perfection. Like it's impossible, right? To get all the nutrients we need, nowadays with soil being nutrient depleted, and, the inability for me to access organic food all the time, and to get, grass-fed beef, at my beck and call, things like that I wanted to make sure I was addressing all of my symptoms in as many different ways as I could. So, when I created this supplement system, it has like the omega-3s. Like I would never eat enough fish to get enough omega-3s that we actually need for brain health, or enough vitamin D. And it has a sleep product in there, a probiotic in there. There's 48 ingredients that address stress and inflammation and all of those things. So I think from whatever angle women can, I think we need to, even if it's just small micro steps of doing a little bit of everything, addressing your gut health, your sleep, your stress levels, your vitamin D levels. I think it has to be all, and it doesn't have to be overwhelming. I think there's little things we can all do that can be enough to really reduce our risk.
Yeah. I'm pretty confident most of our listeners are, you know, we like our good supplements. So,
Yeah.
you know, they're not a prop. Like you can't just supplement your way out of poor
No.
lifestyle choices.
No.
But we live in a world where I think, you know, there are certain threats and toxins and things like that to our bodies that it can be supportive to have nutrients, especially because our food has also lost a lot of its nutrient density. Bringing some of these in to fill the gaps can be really helpful. And also it makes the transitions a lot easier, right? And just like you said, addressing the microbiome, there's so many herbs that can help support the immune system and the microbiome as hormones start to shift. And I'm interested in asking like which ones you feel like, because you mentioned blood sugar a few times. And I think that blood sugar, I mean, we see it across populations, even with children, but this seems to be a cornerstone piece of the puzzle for women, especially when it comes to weight gain.
Yeah.
It's like all of a sudden they just, you know, and listen, there's nothing worse because as a woman, it's like you're doing your thing and it's like you're eating the same and you're moving the same. And all of a sudden, like your waistline's getting bigger and you're like, what, you know, and we start freaking out about it and thinking like we don't have control because it would make sense if we had changed everything, but we're still doing the same thing, but now our body's responding differently. And it's like, that is not a comfortable place to be. So let's like deconstruct the blood sugar piece because we also see a lot of peptides. There's Ozempic, Wegovy, all these different things, GLPs and all that stuff. We don't need to go down that rabbit trail, but there are certain things that can help, maybe berberine or fasting or whatever. But let's deconstruct the blood sugar piece, especially. What is it about our blood sugar that we're not as insulin sensitive? Like why is it that women all of a sudden become more insulin resistant? And what are the strategies that you've seen that have helped women address that so that they don't have that period of time where they feel like they have weight gain or that they're craving or that they're crashing, that their blood sugar is just really dysregulated?
Yeah. So again, we can thank our friend estrogen for that. So estrogen generally helps with those things. Now, if you have too much estrogen, that can also lead to weight issues. That's a whole other ball game. But when we lose estrogen, we tend to actually accumulate more visceral fat. So which is why the waistline will increase. So a woman who normally maybe would have been very pear-shaped suddenly might start to find that, you know, her waistline is increasing, and you can be slim and still have a lot of visceral fat. So this is something that I think women need to be aware of, that even if you don't maybe outwardly look like you've gained a lot of weight, you still could be accumulating visceral fat. So the only way to reduce that is with diet, right? And yes, in my supplement system, you mentioned berberine. I did include that, Ceylon cinnamon, chromium. Some of these things are helpful, but you can't out supplement your way out of diabetes. So you still have to make lifestyle changes. So I think increasing fiber, that's actually a natural way of boosting your GLP-1 as well. So I don't know if in our North American diet, if we're getting enough fiber, probably not. And it's hard. If you actually count your fiber intake in a day, it's really hard to get 25 to 30 grams of fiber into a day, along with all the protein you'd want to be getting and, you know, all the other nutrients. So that's something to be very conscious of, is how much fiber are you getting in a day? And even how we work out can change, because I think what I've seen time and time again is a woman will increase her cardio thinking she has to outrun this visceral fat gain. And that actually doesn't always make a difference. It just stresses your body out even more. Because workouts obviously naturally increase our cortisol levels. When you're already stressed out and then you keep stressing your body even further, it just causes more weight gain. So sometimes it's working out smarter, not necessarily harder. So it's increasing strength training, I think, is more important. And I don't know if enough of the general female population does enough strength training. And that's not just lifting 5-pound weights, you know, for 12 reps. It's actually trying to increase how heavy you lift. And it's working towards lifting heavier and heavier. And doing cardio exercises that maybe aren't full tilt. So if that's brisk walking for you, if that's cycling, swimming, you know, things that maybe can keep you more in a zone 2 range, which is where your heart rate is up just enough that it's up, but you could still hold a conversation if you really needed to. That can sometimes be beneficial too in this age bracket where, we're seeing weight gain regardless of how the effort we put in, and we haven't made any other changes in our life. And I think then with diet, the verdict that most women don't want to hear is you have to cut out your carbs. And that's the processed carbs, right? Like I think keeping your low glycemic fruits and vegetables and all of that is great. But even things like sweet potatoes and, some of the starchier vegetables that maybe we could eat to our heart's content back when we were a little bit younger, not so beneficial necessarily to our blood sugar, right? You have to be a little bit more aware that you're eating low glycemic fruit and veggies, right? And getting your fiber that way.
Yeah, I'm interested in the fiber piece. I think we are undershooting fiber quite a bit. What are some of your go-tos to get fiber?
Yeah, so I eat a lot of berries just because they're tasty and then it's a nice way to get it. But I add a lot of like flax and chia to smoothies. Yeah. I will take psyllium husk powder too, because that's another quick way to get kind of a shot of fiber without overeating as well. Because again, there's only so much you can consume in a day, but I find the chia and the flax really helps you because you can sprinkle it into smoothies or into, berry bowls. And there's ways that you can sneak in fiber. If I'm making like a homemade, bolognese, for instance, like I will chop veggies and stuff into it and blend it in so that, again, you're getting more nutrients and fiber that way too.
Okay. Yeah. I love the berries. Like sometimes we don't think about that, but I mean, not to like give you guys TMI, but that is a really easy go-to if you're traveling and you can get your hand on like some organic blackberries, blueberries. I mean, honestly, if you hydrate well and have slam down a little carton of, organic blackberries, let me tell you, you'd be going to the bathroom. If you can't get your hands on some magnesium or whatever it is, that actually does work. And I also I like inulin. I don't know if you use inulin at all.
I have never tried, no, but I've heard that helps.
Yeah. And that can kind of, work as like a prebiotic to nourishing gut flora. So I'll add that in a lot of times. And hemp protein can have a high level of fiber as well. So if you're using like a protein, what I'll do is I'll split, like sometimes I'll talk about, like this beef isolate protein that I'll use. And then I'll also use like some hemp protein because it's got a lot of fiber in it. So if you're someone that's like doing protein smoothies or you're doing like protein bowls, a lot of times they're not high in fiber, because a lot of times a lot of women are staying away from a lot of the fruits. And so they're just doing protein powders and collagens and things like that. And it's like, that's great. But also it's like really high protein without any of the fiber. And so if you're struggling with, bowel motility, detoxification, balancing hormones, balancing blood sugar, you're going to want to add that fiber in. So those are good options. I love flaxseed. I love using a little psyllium husk at times too. Yeah. So I think finding different ways to be incorporating that on a regular basis, that's something that I find is like, it can really change even like your GI tract, like how you feel. So it's supporting the hormones, which I think that's interesting. Most of us don't think about that. We just think about it in terms of digestion, but it does support hormones as well. That's a great strategy.
Yeah, the other thing that I tend to do is because I think we also, when we feel like we've put on weight and we switch to salads don't have a lot of fiber in them, right? Like lettuce doesn't, for sure. I tend to add a lot more cruciferous vegetables to the side of my meals as opposed to a salad per se, or have both, right? But roasting up, any of the cruciferous, whether it's Brussels sprouts, broccoli, cauliflower, cabbage, all of it roasted, delicious. It's so tasty. And it's a great way, again, to kind of add fiber to every meal.
Yeah, that's so good. Yeah. Get your fiber in, ladies, get your protein in, lift heavy weights. Yeah. I mean, like you said, you don't have to go out and do like box jumps and sprints and just gas yourself. You can really change your body and your metabolic threshold by putting on lean muscle mass. Dr. Gabrielle Lyons talks about this as it being the organ of longevity. And it truly is. If the more muscle mass you can maintain, the more insulin sensitive you remain, the lower your inflammation. So just downstream, you're going to be healthier and you're less likely to develop some of these chronic disease patterns. And I think that for most of us, like that's something that we're looking for, and we're not looking to overcomplicate it. Like these are, if you can just work in some of these things to your daily routine, you're not having to spend hours a day trying to figure out what you're missing because you're just doing the basics. Foundations are everything. I find that simplifying is so important. Just don't get deep. If you're having to get too deep in the weeds, then you're likely missing one of the big pieces. And every now and then there are some like isolated nutrients and things like that that are driving symptoms, but most of the time it comes back to foundations. Now, I want to ask you this because you're seeing women all the time with hormones, and as they're kind of working through these transitions, what is it that you feel like most women need to be doing annually? Do they need to be running hormone panels? Do they need to be running routine lab work? Do they, what is it that you feel like is a good metric or a good rhythm of evaluating metrics so that they can track their progress?
Yeah, our bodies don't stay static. So we 100% need to, on a yearly basis, be looking at all of the major organ functions. So getting a full panel that's addressing what is your kidney function, what is your liver function, what is your thyroid doing, and not just the basic like panels, right? Like we need to know that we need, for instance, for thyroid, like free T3, free T4, like addressing the antibodies, or do we have more than just a low, thyroid level? Is there something actually happening with our organ? And I think this is what's missed generally in medicine, right? Is that we'll just do a TSH level, it comes back normal, and then, you're told, oh, you're fine, but you have all these symptoms, and that's not necessarily the case. So I think it's finding a practitioner that will actually deep dive and do a little bit more of a thorough panel for you. Yes, you can be looking at your hormone levels. We should be looking at our vitamin D levels, and all of these things can help you catch things before it's too late. Like, what are your iron levels doing? Do you need to be supplementing with an iron supplement? Are you anemic? Because all of these things can factor in that you can be doing all the right things and have a low iron level and feel like you have no energy and not know why. So you need to see it. It is a very objective thing that can be done, and it's very easy to do, but it means prioritizing your health and making this like a scheduled routine thing, getting your regular mammogram done, getting your colonoscopies done. Like these are all things that we can be catching things so much earlier if we schedule in our routine, workup on a regular basis.
Yep. Yeah. Those are really good. And honestly, like if you're looking for lab work, we've had another guest on here, Emily Morrow. She's done a specific podcast talking about lab work and the different markers. Go back and check that out. I also have on my website, my personal website, you can order comprehensive metabolic panels, CBC with iron, full thyroid panels, all of that. Have all of that laid out because I know a lot of people are looking for that as a resource. And so that's just a plug. Even if you're just looking for the markers, you don't have to order it, through me by any means. But if you're curious as to which markers you should be asking for your provider, because maybe it's a specialist, they're not looking at a full thyroid, you can go and utilize that. Like find the people that do know that so that you're getting enough depth so that you've got enough data. I think a lot of times we're skimming the surface, we're missing a lot of pieces to the puzzle. And so things slip through the cracks, and because you can't make sense of it when you only have a fraction, if you only have a third of the puzzle, you can't see the full picture. So do a little bit of legwork on that because it does go a long way. And on top of that, you can start to see the shift. So like you said, before you start feeling symptomatic or seeing the consequence of deficiencies in your body, you'll be able to track some of those changes by way of data. And you've got, annual data. And I listen, I do this stuff for a living. And like, sometimes I'm not as great about remembering to do hormone panels and things like that. I'm getting ready to run my hormones, getting ready to relook at lab work and stuff like that. But if you're a female, get in a rhythm of being able to have some of this lab work done and then save it, like have a folder on your computer or print it out and save it so you can start to see the subtle changes because it will help a provider understand the bigger picture of your health and where you're going. That way you can start to bring it back, because otherwise you're kind of shooting in the dark. Like, you can try a lot of different supplements, but if you aren't fully understanding what you're working with, you may just be spinning your wheels. And that's certainly not a great place to be when you're spending money, spending time, and you're not getting any better.
Yes, agreed.
So, yeah. Okay. So talk to us about your book. Give me an idea of what value can people get by reading through this, because it's all about women taking their health back by way of their hormones and understanding them. And I think that that's a really useful tool. So walk us through a little bit about what your desire was for that book, so that women that want to be able to access that can understand what it is that they're getting.
Yeah, I created the book because I wanted it to be simple. I wanted it to be almost like a handbook that women could, read and understand, like, what are some of the most common issues that we tend to experience. And so there's sections, right? There's sections on any pain syndromes that we tend to experience. There's, what sleep issues are we having? What gut issues are we having? And then within each of those sections, there's lifestyle changes you can make. There's supplements that can help for that particular symptom set. And at the end of the book is like a full comprehensive, description of all the supplements I mentioned, and which yearly or bi-yearly testing is recommended for women and what the current guidelines are. So it's just meant to be something that, you can read through and then kind of keep on your shelf and refer to when you're experiencing something that maybe you need to start actually focusing on that you may not have been in the past.
Okay, so that's great. I mean, that covers a lot of like even what I was just talking about in understanding what markers to be looking at, what symptoms, what patterns, things like that, what's normal, what's not normal. And I think that the lines get very blurred with what's normal and what's not normal. I mean, ladies, if hormones are just a pain point for you, and it's like all of it, your cycling years were terrible, your periods were painful, and perimenopause is awful, like, there's a lot of changes, and I think we just need, embracing it is like allows you to experience it. But if it is that painful and miserable, there's definitely imbalances there. And just because you're transitioning out of one season doesn't mean, well, you're leaving all the problems behind. I think that's to me, what's so important to realize, like, that is the setup for what you're going to experience. And if what you have behind you, if you're leaving a lot of inflammation, a lot of blood sugar dysregulation, a lot of that, and you're transitioning, you may actually experience worse symptoms in that next season, because it's like we're carrying a negative balance over. And so now it's just getting worse. So I don't say that because I'm trying to make anybody feel scared or to feel bad about their transition. It's more or less just having an awareness that maybe spending some extra time evaluating. And we just did a podcast on transitions, but again, it's a lot of it is understanding like where you're going and what you want to, where you're headed, like understanding where you want to see yourself and what your health looks like as a part of that. Like, your body is a vessel that's carrying you forth into the purpose of your next season. So you want it to feel its best. And so some of these are just tools to help support you in that. And again, looking at blood sugar, brain health is so important, but doing all of it now is critical to you experiencing health and longevity. And it's not just one thing. It's always a picture of multiple things coming together, and they all work together as a symphony to produce the health of your body. So this has been so interesting. And I love that we're talking about hormones and lab testing and bioidentical hormones, hormone replacement therapy, all of that. It all has a place, I do believe. But again, taking it back into your own hands in understanding what works for your body is the key. Yeah.
Because to date, medicine hasn't worked that way, right? And yes, I love that, there's so many people coming forward. We're talking about a lot more, reducing the stigma of it, but we're not talking about what we need to be concerned about. And I love that that's what we've discussed today. I would, not that I want women to feel like, oh, what's the point now, right? Then this is more like, okay, we know this is coming, so we can take that power back, because until it becomes a common thing that we're addressing in medicine, it's up to us, right, to advocate for ourselves and to make sure we're getting the proper care that we need.
Yep. And I imagine you've probably seen a lot of women turn it around, like women that are really feeling terrible, that make some of these changes and that can in their 40s and 50s see dramatic improvement. Do you have anybody in mind? Because I love like sharing testimonies. Like, is there somebody in mind that you're like, oh my gosh, this was like a wild transformation?
I've seen bits and pieces from numerous people. Like, for instance, for sleep, one woman wrote to me and she was like, she's sleeping remarkably better just by changing some of these things. I have a lot of women that tell me that by cutting out alcohol in the evening, that makes a huge difference on them. And then they lose weight. So it's interesting how, the things we could do in the past, like I was a huge follower of the low fat diet back in the 90s, back when that was what all you had to do. But I was young, so it worked for me, but like, you can certainly not eat like that now. And I think it's re-educating ourselves, because with every passing decade, we do need to change how we address the next decade of our life. And that makes that right now, I think it's a lot more strict than maybe we could have gotten away with in years past.
Yeah. I mean, listen, if you have breath in your lungs, your body is working for you and it's trying to maintain balance. So if you can get on the same side as your body and just understand it better and how to support it, you will start to feel better. And it doesn't matter how bad it is. It doesn't matter how far along in your journey of life that you are, you can see marked improvements. I've seen it working with clients. I've seen women that have debilitating night sweats. They can't sleep. Like, they're having anxiety attacks at night. They have no energy during the day. Like, they cannot function. And by addressing some of the foundations of their health, within weeks, we're seeing so much improvement. And here's the thing, a little bit in the right direction builds momentum. Yes. So the more momentum, the more healing momentum you can initiate for your body, the faster it starts to run in the direction that you're trying to go without you having to try and force any more energy. So that's what's so beautiful about the body, is like getting someone just a little bit of breakthrough creates so much momentum for them to gain like more wins, more healing in the future for their body. So yeah, wherever you are listening to this, whatever symptoms you have, don't consider it this is just the best that it's going to get. My only hope is that I stop it here and it doesn't get worse. Like, you can actually improve these things. So keep digging. Don't accept what you're experiencing now as like that's baseline. You can experience much better. And hopefully this conversation has given you a little hope. It's giving you some things to think about, some resources that you can check out that will deepen your understanding and give you a better handle on your body. That's what we're here to do. Dr. Kavita, I'm so grateful that you spent time with us today, shared a lot about your book and your supplements, your resources, your brand, everything that you're doing to support women. Can you just give us a rundown really quick where people can find you so they can access this? And guys, we'll also put this in the show notes for you. So if you're out and about and you want to come back to this, we'll make sure we link them. But I want to give you the floor, Dr. Kavita, to give us the places that we can find you.
Yeah, so check us out on Instagram. It's at revival.inc, or you can go to our website, which is www.revival.com.
Perfect. I love it. And she's in Barbados, guys. She's like living on an island. And we were talking about that pre-show. And I just thought, man, I should have done an in-person interview and come to you for this one. But I don't know. Maybe that's the key. If like, you just have to let us know. Maybe we all just need a little more time in the sun and slower pace of life. So I'm finding that goes a really, really long way.
It does. It was finding our joy, right? In kind of a time my mom had just passed away. It was the middle of the pandemic. And I think if I could give any advice to any woman, it's find that little bit of joy for yourself, because it makes a huge difference.
It's so good. That's it, right? Having fullness of joy. And I that is my prayer for everybody that's listening, is that you find that, and complete healing from, your mind, body, and spirit, that you are able to experience a fullness of joy and that love is made complete in you. That's how we're able to walk in our purpose and what we're called to do, because our bodies are set up and equipped for us to carry it out. So, Absolutely. Dr. Kavita, You are just beautiful inside and out. Thank you so much for joining us today. It's been an honor and a pleasure to share this platform with you guys. Thanks for joining. Thanks for listening today. If you love this, please share it with a friend, like it, drop us a comment, send us a DM. We love hearing from you. Want to know the topics that are most relevant to you, how we can support you in your healing journey. And, I just love getting to see the testimonies and wins you're having. So if you have success or there's a testimony, please share it with us. We love to be a part of your journey as much as you're tuning in and listening here. We want to be a part of what you're doing every day. So this is it for the Health Institute. We'll see you guys on the next episode.